Hey everybody, welcome to our live stream co-hosted session with Otis. We've got an awesome session lined up today. Thank you so much for joining. And if you like the session today, please be sure to like and subscribe to our YouTube channel. So before we jump into it, I'll let you know a little bit about the format. We're going to have the extended session with our Otis experts, and Kim Coffey will introduce them in a minute. And then we're also going to have a Q&A, so please drop your questions and comments in the chat box. And also, as we're waiting for people to jump in, please let us know in that chat box where you're coming from, because we'd like to give you a shout out and say hi. So with that, let me turn it over to Kim Coffey to introduce today's expert panel. Hey, Kim.
Hey, Chris, thank you so much. Joining us today from Otis, we have our moderator, Chris Bowler. He's Senior Director, Service Marketing with 15 years of experience. And our panelists today will be Federico Garcia-Para. He's our Senior Director, Global Strategic Accounts at Otis with 25 plus years of experience. And then also Stephen R. Nichols. He's Associate Director, Systems Engineering and Innovation with 15 years of experience.
Thank you, Kim. Thank you, Chris. And thank you, IFMA, for hosting. Hello, everybody. It is a pleasure to be here with all of you today. Before we begin, let me give you some background about the initiative. As the COVID-19 outbreak started, and we talked to our customers around the world, trying to understand what their main concerns and pain points were when they were designing their re-entry strategies into the workplace. We actually learned and realized that ongoing concerns around the spread of the virus during the elevator ride made actually many people become hesitant about riding elevators. So it was clear to us that our clients were facing a real challenge here. We then decided to commission Dr. Qingyan Chen from Purdue University in the US, a study with three main objectives. So first, we're trying to help the industry better understand how airflow affects the risk of exposure among passengers in and around the elevator. And secondly, we try to mitigate those risks through recommended science-based safety protocols. And finally, to provide additional scientific support on how the various air quality products we are offering actually affect the risk of transmission of the virus among passengers. With this study, we really wanted to understand how air circulates inside and around elevators and what actually the relative risk of COVID-19 transmission was. We also wanted to look at how ventilation rate and type, the cab configuration, air purification, and the mask usage could actually affect the risk. But we also wanted to compare this relative risk of exposure to what we know about spending time in common spaces. To crack this nut, we adopted a computational fluid dynamics, which is called CFD modeling techniques. Without going too much into details, since we'll cover it later today, we are starting to confirm that the findings were positive and encouraging. And this takes us to the next slide. Regarding elevator concerns, amid COVID-19, I think we all have been reading and hearing a lot of what has been happening for the last month. What you see here is just a sample of several headlines throughout the world. And it's not just about COVID-19, but about COVID-19 exposure in elevators. When talking to our customers around the globe, we were hearing questions that the riding public was asking around exposure risk in elevators and buildings. And in addition to finding ways to help, we at Otis committed to providing science-based information to help dispel some of the misconceptions that were out there quickly. So it took a little bit of time, but we were able to conduct a study with a great partner, which is actually what it brings us here today. And with this, I leave it to Stephen to cover the specifics of the study in the next minutes. Please, Stephen.
Thank you, Federico, and thank you, IFMA. So certainly there's a lot of questions and there's a lot of complexity to some of the topics we're going to talk about today. But I thought it might be helpful to ground all of us in kind of a common language. I think I am not a medical expert. You likely are not either. But I think having some common framework to talk about relative risk and relative risk of exposure when you're talking about a common activity like riding an elevator is very important. So this is kind of the framework and the definitions that we're going to use and we're going to talk about in more detail later. But I think it's important to understand when we're talking about something like COVID-19, it's not any one thing that is contributing to the relative risk of exposure. It's really a combination of the intensity, frequency, and duration of exposure. And it's those combinations of either limiting the duration, limiting the intensity, and other factors that in combination lead to lower exposure and lower relative risk. And certainly this becomes even more important, as you'll hear, when we compare something like riding an elevator, which is inherently a low duration event, compared to other common indoor activities. So before I begin getting into the details, let's go into some elevator details on the next slide. As Federico mentioned, we were getting questions from all over the world and from lots of people like yourselves about what is the exposure risk in an elevator. These are things that we knew about elevators going into the study, but may not be common knowledge. You've likely ridden in elevators or worked with elevators for a long time, and you may not realize that by code, all elevators have openings for ventilation. They're required in every region of the world, and that in combination of the fan that is often there means that an elevator is one of the best ventilated spaces in the building. So you can see in the animation on the right that in this case, that those openings I'm talking about are at the top and the bottom of the elevator cab, and depending on the direction of the fan, the air either is coming in through those openings and out to the fan, or in through from the fan and out through the openings. That pass-through ventilation and airflow that is present in nearly every elevator cab is very common, and in combination with the fan provides a higher level of air exchange than many other places. So these things, and then in addition to the exposure time, are already working to reduce the overall exposure. So for example, even in the highest rise, most complex buildings, the time that you ride in an elevator may be less than 2 minutes. In most elevator rides, it's less than a minute. It may only be a few seconds between two different floors. So all of this information is things that we, as the leaders in the elevator industry, were aware of and knew, but in order to answer more questions, we worked with outside experts to clarify this amid COVID. So on the next slide, a little bit about our partner. So I and others in the Otis team had the pleasure of collaborating with Dr. Chen. Jan is a professor at Purdue University and really one of the world's experts in this area. He is not just an expert in airflow, but the modeling of the airflow, as Federico described before, as well as the modeling of the airflow with the particle dynamics of infectious diseases and a pathogen like COVID-19. So this is where the techniques that Jan and his team have developed to study aircraft cabins and have published hundreds of papers on in the past have really benefited us, because we took Otis's expertise in elevators and elevator technology, combined it with Jan's expertise, and you're hearing about some of the results of that research today. So a little bit more detail, not a lot of detail on what we did on the next slide. As Federico already mentioned, we used a technique called computational fluid dynamics. So this is really the modeling or the simulation of the airflow and the environment in a computer. So it was very helpful for us to model and simulate all of these dynamics in a computer because we were able to go through many more variables and study many different situations much faster in order to get as much information out to you and others as soon as possible. So we were able to look at different ventilation rates, different ventilation types, different purification technologies and cab configurations, as well as the movement of the people, the movement of the air, the movement of the particles in the air, and the elevator itself. All of those things in combination is what we're trying to kind of summarize simply today. If you want more information, we'll talk about it in a little bit. A lot of the information is available on otis.com. And as Federico and Chris already highlighted, it's important to us to get the science-based information out there and share this as broadly as possible so that people can understand the results. So on the next slide, there's a little bit of details on the quantification of that exposure risk. So let me kind of reinforce some of those concepts that I mentioned earlier and show you what we're talking about. On the right-hand slide, these are the elevator situations. So this is a 2-minute elevator ride in a high-rise elevator that has a high ventilation fan, and a 2-minute elevator ride in a low-rise elevator that may have, due to other reasons, a lower speed fan. In general, both of those elevator rides are lower exposure risk when you compare them to a day in the office, an hour on a bus, and other situations. So, and this really comes from that combination of intensity, frequency, and duration of exposure that I mentioned before. And we were able to model, using the CFD techniques, different situations. It was important for us to get what sometimes in engineering we call an apples to apples comparison, because we know that you and others are doing a lot of things to improve the office environment. But this shows kind of the relative risk in an elevator compared to other things. If you go into the next slide, this is a little bit more detail on the elevator itself. The airflow in an elevator is dynamic. It is not necessarily completely perfectly well-mixed air. There is some turbulence, and the details of how things change when the doors open and close or people move in and out are important factors that we were able to include based on how the modeling and the study was done. What we're showing here is, again, that high-rise, high ventilation case on the right, as well as kind of the low-rise elevator, which may have a lower speed fan in it. It's also important to note here that we're quantifying the level of air exchange that is common in many elevators. So you may now be familiar with the abbreviation ACH. This stands for air exchanges per hour, or this is the air exchange rate. You'll see across industries, other experts are recommending to potentially increase the level of air exchange to help with ventilation and help move particles and the pathogens out of the way. So this is what we mean by elevators already through their design have a higher level of air exchange than many other spaces. That 72 air exchanges per hour is quite high when you compare it to an office environment, which may be 2, 3, 4, 5, hopefully increasing now with other mitigation strategies. Every space is a little bit different. But the elevator space is a higher ventilated space than many other places in the building. It's also important to note that all of these quantifications, the results of our modeling that I've shown before, do not include mitigation strategies. So this is people that are, at the moment, what I'm showing is people that are not wearing masks and not employing other simple techniques. If you go to the next slide, this is a simple summary of what happens when you add some of those techniques. So certainly proper mask usage is something simple that we all can do. And proper mask usage cuts the relative exposure by 50%. But it's also important to note that beyond the mask usage, the relative risk of exposure can be reduced an additional 20 to 30%, or 20 to 30% in general, with the advent of air purification. Specifically, that what we modeled was a purification technique called needlepoint bipolar ionization, which is a good technology that can be applied in the elevator. So certainly there's lots of different air purification technologies that can be applied to different spaces, but it was important for us to study what makes sense in an elevator environment and what makes sense in that short time horizon that people may be riding in the elevator. So I think this is a theme that you may have heard in other places. There's no one silver bullet necessarily, but through a layered approach, the addition of proper mask usage, the addition of air purification, all of those things add up to reducing our overall exposure. And this is the quantification of the exposure, the relative exposure reduction in an elevator. And on the next slide, we broaden it to comparing an elevator to several other activities. So if you go back to that framework that I introduced at the beginning, it's sometimes hard to compare different things that have different quantities of intensity, duration, or frequency of exposure. To use my analogy, if I'm comparing apples and oranges, or apples and oranges and pears, that makes the problem a little bit more complicated. What this chart is trying to do is show some of that apples to oranges comparison. So things that are high intensity and high duration, perhaps, are things that are usually higher exposure categories. This puts the elevator ride in that lower or low to medium category, but that already low exposure risk can be even lower with the simple mitigation strategies like wearing a mask and adding air purification. So we're all operating in different touch points, and certainly as the world continues to change and we find these new normals or return to work, it's important to have these comparison points, and hopefully this shows and reinforces that short ride in an elevator is one of the lower exposure areas and can be even lower with simple mitigation. So let me wrap up and confirm a couple details on slide 13, the next slide. The next slide is really kind of a summary of some of the points. So to reinforce a lot of the details, an elevator is really has a high level of ventilation and a higher level amount of air exchange. And then that high level of air exchange in combination with other simple mitigation strategies like wearing a mask and simple air purification techniques can lower the risk quite a bit. So, and again, there's a lot more information on otis.com, including summaries and a white paper on a lot of the technical details, as well as some of the things that more detail beyond what we've shared here. Federico, do you want to add some more details about how this fits into other things?
Exciting findings. I just wanted to talk about, while we were working with building owners and managers on a global scale, given our footprint, Otis teams have seen many interesting ideas developed that experts have recommended with help smooth the transition, right, and going back into the workplace. So these are ideas like staggered passenger arrival or departure times, or temperature checkpoints, or occupancy limits, or social distancing via floor markers and passenger communications, or sanitizer stations. So since the beginning of the outbreak at Otis, what we did, we continued to innovate solutions for our customers and their tenants. And as this work went on, we focused on ways to provide behavioral guidance as well as advanced technological solutions to support the riding public, but also building owners and managers. These include purification products or touchless solutions, passenger communications, which include promotion of social distancing and also remote monitoring service. For more information, we actually hosted a webinar on the topic with our host today, with IFMA, so you can find this in their library, or you can contact us and we can share with you more information about this. So this will take us to the following slide, the final slide, before we open the discussion. And I hope, Stephen has already mentioned a little bit about this, but I hope all previous information has been helpful. And on this slide and on otis.com, more resources can be found. There is some summary information, a more technical document, which is a white paper, and different layers of information for different audiences, and to make this come alive and meaningful to you and also to your specific situation. So with that, I'll leave it to Chris Bowler to start the open discussion and to receive the questions. Thank you very much.
Great, thanks Federico and Stephen. Great presentation as always, and I hope our attendees today found that information useful. We're starting to get a few questions coming in, some really interesting ones, and I just know, please do type your questions into the comment box and we will get to as many as we can now while we're live. So the first question comes from Jennifer, and I think this one's for you, Stephen. Any guidance on what is working best to move people in a high-rise building with limited capacity elevators? We are struggling with how to move people without long extended wait times. You know, and maybe the study, Stephen, can help put Jennifer's answer Jennifer's question here, maybe a different way.
Yeah, no, it's a great question, and I think it's something that is both a common theme we're hearing from different parts of the world, and then the answers can vary, because certainly kind of the recommendations and the regulations in different geographies vary quite a bit. And there's a balance between kind of the occupancy in the building and the wait times, as well as kind of the occupancy in the elevator itself. Certainly that the scientific finding that riding in the elevator is a lower exposure risk is an important thing for everyone to realize. And then that, in combination with other things, proper mask usage, adding air purification, can lower it even more. And that, in combination with even other solutions beyond some of the things we've talked about, whether it's adjustments to elevator dispatching, whether it's additional touchless solutions that are coming to the market, those are some of the things that those buildings should look at. And I think Federico and Chris, you probably have some good examples of other solutions in specific customer sites or cities.
Yeah, I think it's maybe a comment back for Jennifer, you know, and maybe we don't know how many people you're limiting in the elevators based on your question, you know, but based on the study and the findings that Stephen's taken you through, and Federico, you might want to think about adjusting the capacity of the elevators so as not to create those long extended wait times. What we've also seen, certainly in large commercial buildings where you have multiple tenants, is that the tenants are starting to kind of phase in when people can come into the building. So today, roughly, you know, we plan an elevator system for diversified units to be able to move all people within that building based on the projections when it's built in about 40 minutes. So if you think about, you know, just extending that by twice, you'll naturally have half as many people in the elevator. So that's another way to think about it, you know, to space out the start times of the different tenants within the building. Federico, would you like to comment based on your experiences recently?
Well, it's in line with what you just said, and we've been helping customers in buildings across the world. We have examples in London, in the UK, in New Delhi, and across the world. And it would all depend, of course, on the population and the peak times that they have, right? But we can certainly support them, and you know, with our software in order to analyze what would the best solution be, and also what would the impact on the traffic be.
Yes, Jennifer, that's generally one of the services that we can offer as to Federico's point. We can do a traffic analysis and help you understand that in a bit more of a scientific way and model it for your building. Or if you don't have Otis as your maintenance company, I'm sure your current maintenance company could offer that kind of level of service. It really becomes very project and building specific. But great question, thank you. Actually, just moving on, because it's a similar vein here. This is from Jason. What's being done to remove the opportunity of the virus being transferred by touch in the lift car? Maybe Federico, and we talked a little bit about that at the end of the presentation. Maybe you can just highlight that a little bit more.
Yeah, thank you. We do have, correct. Yeah, we do have several ways to avoid touching any buttons in COP or on the landing floor. The first one I could think of is our app, which is called our Eco app, and this is an application that allows you to place a call in the elevator using your mobile device without actually, you know, having to touch anything. Something I would like to highlight here is this can be used for new buildings that have been used, but also in retrofit. And we have other solutions, such as for more, let's say, less sophisticated installations, we could, you know, preset the elevator unit, you know, and to constantly in every floor, or a number of assigned or pre-assigned floors. And also, I would like to highlight that we've been working, and we're already piloting gesture solutions and voice solutions, which will also allow you, again, to place calls, avoiding to touch any surfaces at all. Thank you.
Thanks, Federico. And I mean, and we have a global audience on the call today. And I would just check with your Lotus companies that some of these solutions are certified in certain regions of the world, but not in others, due to local code and things like that. So, but there's quite a breadth of solutions available today to help mitigate touching any buttons within the elevator cab. So the next question is from Ramona. And the question is, doesn't NPBI produce unhealthful quantities of ozone? Stephen, are you able to answer that question?
Yeah, Chris, I'm happy to take that one. So I think that the simple answer is that there's lots of different air purification technologies available on the market broadly, and those technologies vary quite a bit. So for example, needlepoint bipolar ionization is part of a broader family that includes other ionizing technologies and other types of air purification that you may see advertised or discussed, like as PCO or photocatalytic oxidation, and several other more technical terms. I think that the simple answer to the question is that what is produced by that device depends on the device. So for example, the cab air purification device that Otis is offering that uses needlepoint bipolar ionization is certified to the UL 2998 standard, which is essentially zero ozone production. So that what devices have been certified to, how they have been tested, and how they are applied are all important. So for example, even within one technology like needlepoint bipolar ionization, how it is applied in an elevator and how it is applied in the large air handling system of a building may be quite different. So it's important to ask for more details about the device. And in the case of Otis, we've looked at kind of dozens and hundreds of opportunities, and the technologies and the devices that we are offering are meeting kind of the quality and the other standards that we certify all of our other components to. So certainly there's more information about the devices that I spoke about specifically today, but as you're looking more broadly, it's important to ask those questions.
Thanks, Stephen. That's great. There's a question coming up, just kind of going back to the presentation. And, you know, it's around this risk of exposure in different environments. And so can you explain how the risk of exposure to COVID-19 in an elevator is lower than in a larger indoor space?
Yeah, so it's a great question, Chris, and I can take that one. So again, when we talk about relative risk of exposure, we're really talking about that combination of intensity, frequency, and duration. So number one, elevator rides are lower duration than many other events. 2 minutes in an elevator, a minute, a few seconds in an elevator is very different than an hour or a day in a larger indoor space. And certainly when you look at the technical details behind how elevators are designed, they have those openings for ventilation that are required by code, as we described. They have higher level of air exchange, and they have technologies like the fan and the air purification. So when you combine the openings and the high level of ventilation, the high level of air exchange, and the duration, it gets to be quite of a low form of exposure. So this is where in other indoor spaces, it's hard to make generalizations, but spaces where you are there for longer that may not have the ventilation and may not have the airflow, those are things to look at. So certainly, as mitigation strategies are adding in other parts of the building, that's helpful. But the general principles of intensity, frequency, and duration of exposure can be applied to some of these other common indoor activities.
That's great, Stephen. Yeah, I think it's not very well known, you know, there's natural ventilation within elevator cabs. And you know, I know a lot of the folks on the call today will generally be responsible for large buildings with a large number of elevators, but most elevators in buildings just have one elevator, right? If you think about, you know, as we look globally, you know, 60% of buildings just have one elevator that we maintain, and then 80% of buildings have 2 elevators, and they're generally 4 and 5 stops. So the actual risk in the majority of the buildings is even lower if you think about the time that you spend in the elevator. Any comment on that, Stephen?
Well, no, I think you make an excellent point, and I think the other point that I thought of as you were sharing that is that there's lots of details about elevators that people may never have noticed before. So for example, those openings for ventilation, they're there, but you may not have seen them because they're at the top or the bottom of the cab. That there may be kind of aesthetic panels or the cab design as made them obscured. But as you said, that pass-through ventilation, the airflow moving air in and out of the elevator is there. It's required by code, and that low exposure risk is present whether it's one elevator in a building or part of a larger campus.
Great, thanks, Stephen. We have another question here from Jason, and this is kind of an unusual case, this one. So when we think about ultra high buildings, Stephen, the elevators are generally designed to reduce the pressure changes as you move up and down the elevator shafts at high speed. Anything that we should think there about from a COVID perspective? Do they still have the natural ventilation, in the elevators there, or is there some other way that the air is circulated?
Yeah, so it's an interesting question, and it's in some ways a unique case. So the first thing I say is that elevators are a little bit like people in the sense that every single one of them is a little bit different, and in some ways, especially for very unique cases like this, it's best to kind of consult the local expert. But it highlights a bigger point, is that there's many factors that come into elevator design. So for example, that pressurization in those very high-rise, high-speed cars is really due to ear comfort and the natural process in the inner ear of not wanting to change pressure too quickly in altitude. So when we're adding factors like that for high-rise, high-speed cars, we do other things. So for example, many of those cars have a more complex HVAC system, or those cars already may have air conditioning, which is not common on those common elevators that you were talking about a moment ago, Chris. So this is where the simple answer is the things that are done on those elevator cars are a little bit different, but the principles are the same. We want to increase airflow. We want to potentially add air purification. We want to look at the level of air exchange the same way that we're applying those across the other factors. So, and it's a little bit of a non-intuitive point that the speed of the elevator is not necessarily a direct contributor to the overall exposure risk level. The time you spend in the car, in the elevator car, or the duration you spend in exposure is more important. So for example, in those high-speed cars where the duration may be quite short, that's another factor. So this is where it's a combination of all of those things. And certainly as we look to help not just elevators in the current portfolio and help all of you that are moving in and out of buildings today, that's one of the things we're doing, but also the results of this study in combination of other things are helping us look at how we improve designs for future elevators, both in the buildings of tomorrow and where we go beyond.
Great, thanks, Stephen. We have a question here from Jovita, and she says, hi, the current loading capacity is based on weight allowed. So, you know, we have an 800 kilogram cab in most of the world, and that equates to about 10 people from a rated capacity perspective, as an example. Having considered air circulation, social distancing, is it now a chance to review it to a safe level? And one of the things I would say first, Rita, and I'll pass it on to the guys, is, you know, when we do a traffic analysis and when we're planning for the building, we never assume 100% capacity. We always assume 80% capacity. And just because, you know, you may have other bags and people got carrying things, but also you want to allow a space as well between the people. And so that should kind of build into this. And this is why we really think, you know, for very specific buildings, it's worth doing a traffic analysis to really understand what you could load the elevator to that would still help to manage the waiting times for the tenants within the building. But Stephen, would you like to add anything else onto that for that question?
I think I'll kind of reinforce some of the things you already said, Chris. I think any elevator design and kind of elevator dispatching question is really a question of balance. One of the ways I've talked about this in the past is that elevators are really a system inside of a system. So what you're doing in one elevator can affect other things in the building. And to your point, balancing the traffic analysis with, in this case, maybe the COVID restrictions in your area is something to look at. There's no one solution. It's really a layered solution of how do you increase airflow, how do you work on some of the traffic patterns that you talked about, how do you look at kind of the evolving restrictions in kind of your building and your city. And hopefully kind of some of the framework and the ideas we've suggested of simple mitigation strategies can help.
Perfect. So I'm just going to give a final call for any more questions, and you can type those in on the comments of the webinar here. And while you're doing that, I'll just highlight again that you can go to otis.com, and we have many COVID resources available online, including the full white paper. If you're very technically minded, you can download that and review it. There's also an executive summary available on otis.com, which is a really nice 2-page summary that's easily read and shared. And then there's also a nice little video as well. The video really helps to explain kind of how elevators are low risk due to COVID. I see one question coming in here, and from D. Tricky. Has Otis made changes to address the impact of COVID on field service technicians and how elevators are serviced and maintained? Solutions that improve diagnostics and/or parts requisition. So I'll take this one first, guys, and then you can add on. So we've been working very closely with our customers over the last 12 months to make sure that the elevators are maintained properly. But in other cases, based on reduced service, and so we've been really monitoring how the elevators have been used, and then changing how we service those elevators based on the amount of use. And we are looking at new technologies, and you may have heard that of IoT, Internet of Things, and we're able to now connect to the elevators and move data from the elevators up into the cloud, and then determine, what is the status of the elevator, so that we can plan to provide maintenance when it's needed, and be able to track that through our internal systems, but also make that available to our customers through an online customer portal. So that really is helping, and we're able to, in some cases, if the elevator stops working, we're able to actually remotely diagnose why it stopped working, and based on the reason, in some cases, be able to put the elevator back into service without having to send a mechanic to site, which, in totality helps us keep our mechanics safe, but it also gets the elevator back into service quicker. So, and with that, and if the mechanic does need to come to site, they have apps now available. So I'd see the question is specifically around parts requisition. So an elevator mechanic can order a part directly from the mobile phone and have it delivered to the building where the elevator is, generally within less than 24 hours. So we've kind of really helped to reduce that time that it takes to replace parts on an elevator and move that back into service while keeping both our customers and the mechanics safe during this time of COVID. So Federico or Stephen, is there anything you would like to add to that great question?
Yeah, I think, you very well described it, Chris, but I would like to highlight, we were already investing heavily on IoT solutions, but of course the COVID outbreak, what did is accelerated our investment in this. And we see that in buildings and in cities, we see that customers will be expecting more seamless experiences, and IoT will help us also enable this. And also with that data that also Chris is referring to, we will be able to share that data with the overall system of the city, what's called the MaaS, the mobility as a service, right? And interact with other critical components of the transportation systems and adjust our services of our elevators to adjust to the new peak times. Because as we see, it's going to take time until we go out toward, back to the days of 9 to 5 working hours, and it's going to be much more staggered. And for that, we need the systems to be intelligent and to be integrated in order to be able to provide with the right performance and also experience. So I just wanted to emphasize on that.
Thanks, Federico.
Yeah, and I think that makes a lot of sense. I mean, the one way I'll kind of sum it up is we spent a lot of time today talking about kind of broadly purification and hygiene. How is the airflow in the elevator already reducing the exposure risk? But as we broaden it up to these other things, it's a great question about what are we doing to continue to service and maintain elevators and continue to help the people that are service and maintaining elevators so that they're doing their jobs well and smoothly and they're safe as well. There's lots of other efforts that we haven't talked about today, but if you look at kind of that IoT roadmap that you talk about, and a lot of the questions we've talked about in COVID, there's other information available from Otis on not just purification and hygiene, but some of the touchless solutions we've touched on, the improving passenger communication within your building, and some of the monitoring and tracking of both people and equipment along some of those solutions that we've talked about today.
Great. Thanks. Great summary, Stephen. So we're going to pass it back to the IFMA team now to close out the webinar. You're on mute, Chris.
Thank you, sir. Thank you guys so much, Chris, Stephen, Federico. Thank you guys. It was a very informative session. And as Federico mentioned, there's another webinar. So we will we'll send that. We'll put all those links in the description below. And they had pointed out you can go to otis.com for a lot of good information. So we'll round up all those links. Huge thank you to all of the expert panelists, and a really big thank you to all of the audience for attending. As I mentioned, if you can, please like and subscribe to the YouTube channel. We'll have this video up there as well as a lot of other great content. Thank you so much, and we'll see you on the next one.